Welcome to another episode from the Veterinary Research Channel. Chronic kidney disease, or CKD as it is often called, is a significant health concern in our feline companions. Veterinarians and cat owners alike are constantly seeking a better understanding of this condition to provide the best possible care. Within the context of CKD in cats, a microscopic condition known as nephrocalcinosis, which involves the deposition of calcium in the kidneys, is quite common. However, the ability to detect a more substantial form of this condition using ultrasound technology, and the consequences of such detection, have not been thoroughly investigated until recently. Researchers at the Royal Veterinary College and Utrecht University set out to explore these very questions. Their objectives were twofold. First, to identify factors that might increase the risk of a cat with CKD developing ultrasound-detectable nephrocalcinosis, and second, to understand if the presence of this nephrocalcinosis influences how CKD progresses over time. To achieve this, they conducted a prospective study involving 36 cats diagnosed with chronic kidney disease. These cats were carefully selected and categorized based on whether they had elevated levels of ionized calcium in their blood. The researchers then used ultrasound imaging to check for the presence of nephrocalcinosis and followed these cats over a period of 12 months, collecting various clinical and laboratory data. Now, let's delve into what the study revealed. A significant finding was that ultrasound-diagnosed nephrocalcinosis was present in a notable 61% of all the cats with chronic kidney disease that were examined. Interestingly, this prevalence was even higher, reaching 81%, in the subgroup of cats that had hypercalcemia, meaning elevated ionized calcium levels in their blood. Upon analyzing the data collected at the beginning of the study, the researchers identified several independent risk factors associated with the presence of nephrocalcinosis. They found that cats with higher concentrations of ionized calcium in their blood were more likely to have nephrocalcinosis. For every 0.1 mg per deciliter increase in ionized calcium, the odds of nephrocalcinosis increased by a factor of 1.27. Similarly, higher levels of phosphorus in the blood were also an independent risk factor, with the odds of nephrocalcinosis increasing by 1.16 for every 0.1 mg per deciliter rise in plasma phosphate. Furthermore, elevated levels of creatinine in the blood, a key indicator of kidney function, were also associated with a higher likelihood of nephrocalcinosis. The odds ratio here was 1.29 per 0.1 mg per deciliter increase in plasma creatinine. Finally, increased activity of alanine aminotransferase, an enzyme often used to assess liver health, was also identified as an independent risk factor. For every 10 units per liter increase in alanine aminotransferase activity, the odds of nephrocalcinosis more than doubled, with an odds ratio of 2.08. The study also examined how nephrocalcinosis might influence the progression of chronic kidney disease. The researchers observed that cats with nephrocalcinosis at the start of the study showed a significant increase in their plasma creatinine concentrations over time. Specifically, creatinine levels rose by an average of 0.03 mg per deciliter each month in these cats. Similarly, their plasma phosphate concentrations also increased significantly over the study period, at a rate of 0.06 mg per deciliter per month. Interestingly, these cats also experienced a gradual decrease in their body weight over time, losing an average of 0.02 kilograms each month. While the overall rate of change in fibroblast growth factor 23, a hormone involved in phosphate regulation, and parathyroid hormone differed significantly between the groups with and without nephrocalcinosis, either group showed a significant change in these hormones over time individually. The researchers also compared the ultrasound findings at the beginning of the study with those obtained approximately 8 months later. While they did not observe significant overall changes in kidney size or shape in the entire group of cats, they did note that a higher proportion of cats with nephrocalcinosis exhibited a loss of the distinct boundary between the kidney's outer cortex and inner medulla at the initial ultrasound examination. This finding suggests a potential link between nephrocalcinosis and more advanced kidney damage. Considering these findings, the study's discussion section provides valuable insights. The researchers emphasized that ultrasound-diagnosed nephrocalcinosis is indeed a common finding in cats with chronic kidney disease, especially in those with elevated ionized calcium levels. The identification of higher ionized calcium, phosphate, and creatinine concentrations, along with increased alanine aminotransferase activity, as independent risk factors at the time of enrollment sheds light on the potential underlying mechanisms contributing to this condition. The fact that total calcium was a risk factor in initial analysis but not when ionized calcium was considered is logical, as ionized calcium is the biologically active form. The association with higher phosphate levels aligns with the understanding that calcium and phosphate can combine to form mineral deposits in soft tissues, including the kidneys. The link between higher creatinine levels and nephrocalcinosis supports the idea that more advanced kidney disease might predispose cats to this mineralization. The finding regarding alanine aminotransferase is intriguing, and the authors suggest it might be related to the clearance of calciprotein particles, which are involved in the calcification process. However, they acknowledge that more research is needed to fully understand this connection. The observation that cats with nephrocalcinosis experienced a progressive increase in creatinine and phosphate levels, along with a decrease in body weight, over time suggests that nephrocalcinosis may play a role in the worsening of chronic kidney disease in cats. While the statistical significance of the difference in the rate of change for creatinine and phosphate between the groups was not definitive, the trends are concerning and warrant further investigation with larger study populations. These findings in cats parallel observations in human medicine, where nephrocalcinosis has been linked to an increased risk of kidney failure. The study acknowledges some limitations, including the fact that other imaging techniques like radiography or computed tomography were not routinely used, although ultrasound is considered a good method for detecting nephrocalcinosis. The reliance on a single operator for the ultrasounds and a single radiologist for image review aimed to minimize variability in interpretation. While diet was not strictly controlled, no significant differences in diet were observed between the groups with and without nephrocalcinosis. Because the exact time of nephrocalcinosis development was unknown, the study could not definitively establish a causal relationship between the identified risk factors and the condition. The sample size, while sufficient for assessing prevalence based on calcium status, might have limited the power to detect subtle differences in the rate of disease progression between the groups. In conclusion, this study provides valuable insights into the prevalence, risk factors, and potential implications of ultrasound-diagnosed nephrocalcinosis in cats with chronic kidney disease. The researchers recommend that renal ultrasound should be considered in cats with CKD, particularly those with hypercalcemia or hyperphosphatemia, as the detection of nephrocalcinosis may offer additional prognostic information. They also emphasize the importance of regular monitoring of ionized calcium and considering strategies to manage calcium imbalances as a fundamental aspect of managing CKD mineral and bone disorder in these patients. Further research is needed to explore the effects of treatments aimed at lowering calcium levels on the presence and progression of nephrocalcinosis and its long-term impact on the survival of cats with chronic kidney disease. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.